Hey everybody, good afternoon. It's Tuesday at 12:45, so we are finishing up our Ask Me Anything Hour. We're answering all of your questions. I've got 3 very important questions I want to answer today, and if you have any more that you have while we're talking, go ahead and type them in. We'll see if we can get to them today. If not, we'll get to them on Thursday when we do our Ask Me Anything Hour again. But first I want to start with a story, because we are talking about cancer today, and cancer can be a very overwhelming, very scary, very emotional situation, obviously. And the story I want to start out with is the story of a gentleman, what was his name again? It is Stomatis Moriitis. This is a gentleman in 1976 who was diagnosed with stage 4 lung cancer, given 6 to 9 months to live. And he decided he was going to go home and live with his family, so he went back to Ikaria, Greece. Why is that important? Because it's a blue zone. And 45 years later, he was interviewed because he was able to obviously survive this diagnosis. Now, that's not to say that everybody should believe in these Pollyanna stories that all you have to do is move to Italy or Greece and all your problems are going to go away. But the point is that when you get these diagnoses, when you get these scary stories, it's really important to keep a level of focus, or as much focus as possible, on the successful outcomes, on the possibilities, on looking for what do these people have. I encourage everybody to read this story, because what they talk about is the lifestyle changes that he went through. And these lifestyle changes are really profound and massive. And even the American Cancer Association, since as early as the 1980s, was telling us that 2/3 of all cancers are lifestyle and dietary related. And the more we look into this, the more we can learn from that. And even if that's not the case, we should still take some education from that. So a lot of what Strong in Health does is informed by what people are doing in these blue zones, these areas around the world where people live the longest, have the lowest rates of cancer, the lowest rates of obesity, and the lowest rates of heart disease. So we're always trying to examine what are those things that they're doing that we can easily integrate into our life. What are they doing differently from us? And there's a really good article that I'll post below. It's a blog post that was written by Chris Beats Cancer, where he tells a story about this gentleman. And again, this is just one isolated incident, so it's not necessarily 100%, because it's a correlative story, but there's still information of value in there. And the important thing is to keep looking for those things that you can do, and always putting yourself in a position of what can I do to improve my situation. Then there's always something to improve your situation. Now, unfortunately, the first question I have is about a 1-year-old child who has cancer. Now, that changes things quite a bit, because now these aren't lifestyle choices or diet that this child has done that have led them to this situation. So that is a very, very different question. And the question that you asked was about AngioStop, and that is a Dr. Chi product, and he's got a lot of research on that. And I have reached out to Dr. Chi and asked him to give us some information on whether or not that would be appropriate for a child, and I'll definitely pass that information on to you when we get it. Now, all that to say that if that's the case, we can still examine all of the things that they're doing and integrate as many of those into our life as possible. So what we're looking at are ways to strengthen ourselves, not necessarily to combat or try to fight or figure out a way to cure something, but what are the things that the body is needing that is going to create the best possible environment to give you the best possible options to be able to get your body back to healing. That is an extremely difficult situation, and I will definitely be happy to share as many details as I could about different aspects of what I would do personally. But it's a little bit different when it comes to children. And so, of course, that's very upsetting. There are things that have impacted them environmentally that could be a big part of it. Like I said, 2/3 of all of that is lifestyle and dietary related. So we definitely have to be respectful of those 2/3 and see what can we do to make them as amazing as possible, so that at least those 2/3 are no longer contributing to it. Even according to the American Cancer Association, and depending on who you talk to, that could be greatly impacted in many different ways, because there's so many things that we're starting to understand about that. So I do want to offer you guys, again, the important thing is to remember is that there are stories out there that are very encouraging and inspiring, and the important thing is to keep ourselves reminded that yes, this is just an isolated incident, but it keeps us looking for the possibilities. It keeps us looking for the things that we can do, as opposed to allowing us to slide into this category where we are shut down and not believing that we have any options. That will encourage and continue to slowly shrink your life. So you always have to be open and looking at the possibilities, reading those stories, keeping yourself encouraged, keeping yourself inspired, and seeing how much of that you can integrate into your life. Okay? The second question that we had today was about bar. People are always bringing in products to me. Can I eat this? Can I eat that? Is this good? Is this bad? We brought a bunch of products back from Expo West that we're examining and trying to figure out what are going to be the best. And I've got 2 samples I'm going to show you. But I tried to look at the fast bar online. Now there's a lot of things that were kind of raising red flags for me when looking at this, and one of them was I had a really hard time finding what the ingredients were and the dietary information. Lots of advertising on it though. When I did finally figure it out, I did see that there are macadamia nuts and pecans and almonds. That's great. We're always talking about the healthful benefits of nuts and seeds. And in the blue zones that we were just talking about, they're eating about a handful, about 5 times a week of these nuts and seeds. This is really important. It's something I've integrated in my life for many reasons. In fact, I could give you a reason every day of the year why I eat raw nuts and seeds, and every time I talk to somebody, I find more and more reasons why I would. Now, this bar, though, did have honey as its second ingredient. Now, honey's not a bad thing, but we have to look at the sugar content and everything. And if we're getting sugar from a million different things, we definitely don't want to be including it in things that we're taking with a purpose of making us healthier. So we have to be careful of that. There was another red flag and natural flavors. You have to get clarification from the company. What is that? And if you do ask them directly, they should be able to find it. I haven't been able to reach out to them personally. Now, the last one actually ties into our last point. And this is where they put mixed tocopherols or vitamin E, and they said they're putting that in there as a means to preserve it. So vitamin E is a very interesting story, and we've actually been told that D-alpha tocopherol is vitamin D, or that's how we're measuring vitamin E in lots of foods. The final question is about blood thinners, and I'm tying this in because I did do a little bit of cross-checking with Medical News Today and trying to figure out what are some of the things that we would say in conjunction with that. And they cite vitamin E as a possible blood thinner, but only because they're talking about it in forms of that single supplement. This is a massive, massive point in understanding health. When we're looking at things, just because it's rated as a vitamin or that there's a unit to it, doesn't mean that's how it's occurring in nature. A big, big difference between that. There is a warning in this article talking about all of the different things that could happen when taking too much vitamin E, and that's just the vitamin E that is the chemical version of it. When you're getting things from a whole food, it's an entirely different story. There's so many things in food that we don't even realize are there yet. And the way nature has packaged them for us is going to make a much, 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 much bigger impact on our health in a positive way. When you start to take out an isolated portion of something and put it into the system, your body still has to view it as the mechanism that it was intended to be, and it will actually take from your body the nutrient it needs to make this thing whole again, which long-term will create all kinds of problems down the road. So when you're thinking of vitamin E's, there are at least 7 tocopherols that we know of, and these are all compounds as they occur in nature. So taking a synthetic vitamin E long-term can be a very, very bad thing, and I encourage people to always be careful of taking synthetic vitamins over a long period of time for that reason. Eating things in a whole food version, the way God made them for you, is the safest way, and even in the Medical News Today article that I'm going to cite below, it says that exact same thing. It may be safer just to eat foods that have vitamin E in them, because that is a big difference between the synthetic isolations. There's actually a great book called Vitamins in Medicine by Bicknell and Prescott, where they talk about all of the health problems that occur long-term, including bone decalcification from taking a synthetic vitamin E for too long. So we want to make sure that we're getting a really good, abundant, whole food version of it versus just doing the synthetic isolations. I cannot stress this enough. There is so much in food that we don't realize yet. Now, the other portion of this is when we start to change the food, when we heat the food too much, when we are refining it, we're doing all of that and taking it away from the way it occurs in nature, which is making it more and more dangerous for us. A really interesting study we cite a lot here is the Pottinger cat study, where they had cats that could not reproduce after 3 generations, and only thing that they changed was that they were cooking a third of their diet. So what's happening when they're doing that? They're denaturing the proteins and changing the way that the body can be able to utilize it. Why is this important? Because our last question is about blood thinners. We have somebody taking blood thinners, having a massive heart attack. They had a massive heart attack and now have possible internal bleeding. Is there anything that they can take as a natural blood thinner? Now, this is a really difficult question, obviously, and anything that I say after this, you have to make sure that you talk to your doctor about it first. But even in the article from Medical News Today that I will post below, would cite all of the things that I would think of as a natural blood thinner. We're talking about things like ginger and cayenne and turmeric. In fact, our TCG cashews have turmeric, cayenne, and ginger in them because of the benefits that you're getting from that. But you want your blood to be able to clot at some level, right? There has to be a balance, and that's the difficult thing, is finding that. And when you're getting things in nature, you're getting that balance. Now, obviously, this individual is a little further down that road, and they need more than just a natural balance, so they need other options. Garlic would be something that would be supportive. Things like cinnamon and ginger, or ginkgo, those can be helpful. Ginger, I already mentioned. But I'm thinking, again, whole food versions of these and making sure that you're, again, talking to your doctor about it. But the question, again, has to be, what are the things that could potentially be making the blood thick, instead of just trying to force it to be thin with a blood thinner? And understanding that is going to be the biggest thing that's going to help you, not just in that case, but systemically. And so when we think about the things that would make blood thick, we think about potentially too much calcium in the blood. And too much calcium can be in the blood due to a lot of things. It could be due to too much vitamin D pushing calcium out of the tissue into the blood. It could be due to not having enough phosphorus to keep the calcium in solution. It could be due to not having the essential fatty acids to take that calcium and transport it into the tissue. So you see, it's a holistic way of understanding that. And if you understand that that's it, if you're looking at it, you've got really high calcium, now you're informed about so much more about your body. Now you're going to start paying attention to what foods you're eating that contain an appropriate amount of phosphorus, an appropriate amount of the essential fatty acids, and an appropriate amount of vitamin D. Vitamin D is a whole other story that we can get into a longer time. But these are the things to start thinking about. And the final one is also these essential amino acids have to be in this mix. When people are eating too much food, and especially if it's overcooked food, for example, these aminos can be in the blood, and they're not viable, so they're not getting into the tissue because you don't have the essential amino acids. And those essential amino acids are particularly sensitive to heat labile factors, is what they call it. So when you're heating them too much, you're destroying them, you're making it so that your body can't. So your blood can actually get thick because you have too much of these essential amino acids going around in your blood. So it's really important to pay attention to whether or not that's the case. Now, there are things that you can do about that, and we can talk about that another time. But the important thing is, we're talking about prevention, we're talking about long-term. Eating like they're in the blue zones again are going to be making sure you're eating lots of foods that aren't overcooked, that you're getting foods in a raw state, raw nuts and seeds. This is why we always emphasize that. At least a half of your diet, especially vegetables and things like nuts and seeds, eating them raw is going to keep you from having that problem where you're destroying them and denaturing and in getting that heat labile situation that led to the problem, well, one of the main things that was the problem with the cats. Now, of course, we're not cats, but we can learn from that nonetheless. We can understand that there are changes that are happening that are affecting life in a negative way when you're taking it away from how nature occurs. So, I believe that's all I want to say about that. Oh, some of the things you can think about that if that's the case and you want to kind of figure that out is your muscle tone will probably start to diminish a little bit. Fatigue, of course, would be something that you would probably have a problem with. Your appetite might be a little low. Your extremities might be really cold. Now, of course, those things sound like they could be 100 million things, right? It could be a thyroid problem. It could be this or that. But taking all that information in conjunction and thinking about it and really examining what you've done to the system over a while will help inform you in a much, much more powerful way to make decisions that are going to help you be a stronger version of yourself down the road. So, for the individual who had the massive heart attack, again, I would look at all the things that they're doing in the blue zones, because if that's where people have the lowest rates of heart disease, I want to be doing what they're doing if I just suffered a heart attack. I want to see what can I do to support myself overall. Now, am I saying that that's going to cure it? No. Am I saying that it's going to be putting me in step with the numbers in the world that are way beyond any scientific study that are supporting long-term health and longevity and the reduction of risk in those categories? That's what I'm saying. That's why I'm going to do that. So pay attention to what people are doing in the blue zones. Help find out why your blood is so thick and that you have to have that. Or is it just a preventive measure that they're doing it? And again, talk to your doctor. I will put that article below. Keep in mind, read the part about vitamin E. Taking a synthetic vitamin E is not going to be a good thing long term. Getting it from whole foods, always a better idea. Okay, I know this was a really interesting kind of mix of things today, and maybe not the most positive that we're doing, because obviously cancer is a scary thing. But what I want to remind people is that you have to keep looking for what you can do, and always integrating these things in your life is going to have just more than one single benefit. It's going to benefit you across the board because you're supporting your whole body holistically. Way more powerful than just trying to go after one tiny little thing and push that. Okay, thanks for watching, guys. If you have any questions, please keep them coming in. Hi, Angela. Thanks. Hey, and if you have any more questions, let us know. But I'm going to put these links below. Please read the article about the gentleman in Greece. It's just an interesting and inspiring story. And also check out the article about the blood thinning. And note that it is from Medical News Today. So they're going to give the same precautions about what I was just explaining to you when it comes to not doing it from a synthetic form, but getting it from a whole food form. All right, guys, you have a great week. Stay healthy and keep making